Hi there. Today's video I'm just going to do a real quick run through of the patient care plan module which I've just put in. There was an old system with the last video which showed how you could assign resources to a patient on discharge, but it didn't have a full care plan, so like scheduled appointments and tests and a plan for the patient to follow up on discharge. So I'll just run through it. It shouldn't take more than 5 or 10 minutes, I imagine. So there's the new button. It's now called the Patient Care Plan Builder. If you click here, it'll then ask for the patient URN, which you can then enter. I've just deleted this old patient, so there's no patient resources for URN 1, 2, 3, 4, 5, 6, 7. So what the system does straight away is generates a system automated password for them. I'll just put it down here for now. And the patient number was 1, 2, 3, 4, 5, 6, 7. Just so I remember, but it will text message all that info in a few minutes anyway, so it's just easier to cut and paste though. So I'll just whack the email as my email and the phone number as my phone number, so that we can then get some messages directly as if I was the patient. And then we've got the patient's care plan, so we can start adding some stuff to it. To start with, I'll just whack a bunch of stuff in for like right now. So that's 12:37 Arvo. So first we'll say go to Amcal and purchase a spirometer. Capital A, for right now. Okay, and that just puts that onto their care plan. And then we'll say, all right, and we also want you to do the short form 36 survey, and we want you to test your peak flow. And let's say they're also diabetic, and we'll do a blood glucose test. And then we want them to also do the COVID test. I'll go through the COVID decision pathway. Okay, just to check whether they need a COVID test, and then we'll add a COVID test as well, just to be sure. And then we'll say, well, you got a patient appointment at respiratory clinic, GGBHD, I don't know what, ground floor, room 5. That'll do. That sounds good. Okay, so they're the things to do right now. So I've just set them all for exactly now. And now I'll just whack a couple sort of in the future. So they'll do a pregnancy test in a couple of months at 2:15 p.m. on the 4th of November. I'll send them a reminder for that one when it comes up. And then we'll also whack in an appointment for antenatal clinic, level 1 GBHD. That'll do. And we'll put that one in December 7th at 1 p.m. Yeah. All right. You'll notice that it kind of grows your distance between things. So if you've got everything on one day, it kind of bunches them together a little bit. Maybe I could get them a bit closer together. We'll play around with it later. But if there's a month or two between it, it'll start to spread it out. Just, I don't know, gives you some indication of time. I probably have to work on these, to make them a little bit closer together. And actually these need to come down, I think. But yeah, whatever. Sort of fixating on nothing there. So next you can assign just general resources like usual. And you can add some links, links, and after hours contacts for various things, and just like before, you can then view a printout which gives them their login details, and you can hand that to the patient on the ward before discharge, or you can also just save and notify the patient, and so that just assign that to that patient, and I'll get a text message. You can hear my phone going then, with the details on how to log into the system. The text message usually comes in a bit earlier, and then the email should come in a few seconds. So that's it. So we've made a little care pathway, and now there we go. So it's saying, yep, you've been signed some info. You can log in with your patient number or your email address, and then use this password. Cool. So we're done. So now as the patient, you know what, actually? Jeez, I should have added a couple of triggers. So the triggers, it's just like before, you hit the little speaker. So anything with a speaker can have a trigger assigned to it. Pathways, you'd have a trigger within the pathway as one of the branch points. So if they, make a few decisions saying that their health has deteriorated, then you could have a trigger as an endpoint or as a component of one of the pages in the pathway. Whereas these guys, it's just a straightforward value. Your peak flow meter is 300 liters per minute or something. So that you would just say, okay, I want to know if their value is less than 400 liters per minute. Send it to this email and this mobile. And you can add more emails and more mobiles as you want. So we can add a trigger in there. Okay, for less than 400 liters per minute for the peak flow meter, and we can add in a glucose test trigger as well for less than 3. They're going hypoglycemic. We want to know, maybe it's a patient, that they don't understand their diabetes management very well or something like that. I don't know. So yep, there's your options. So you can see the speaker sort of goes, it's yelling at you if there's a trigger there, or it's just quiet if there's no trigger. But things like a clinic appointment, there's no option for a trigger. But you can click on these things whenever you're viewing a patient's care pathway, and you can just look at what's happened. So right now it's assigned today. It's due today. It was assigned by me. I'm a registrar at the moment. I haven't been really playing around with different roles for a while, and apparently I'm surgical 1. And it just says they haven't completed it or even accessed it yet. So they might have accessed it but not completed it, and they're going back to it, and you'd be able to see that. Or you can see, their blood glucose test. It's not been done yet. It tells you there is a trigger associated with it. I think that's everything. I mean, just have a play like usual. And if you got any feedback, let me know. I did promise this would be a quick video, so I'll keep going. So you can then sign out and become a patient. And what was our number? I think it was 1, 2, 3, 4, 5, 6, 7. And the password was this eucalyptus one. And immediately it will ask you to update your password. And so I'll just whack a new one in. Yep, so there we go. Password's updated. And then the patient can see their care plan. It'll tell you what tasks are ready to complete. It's a bit ugly, and I'll work on it. Definitely need those guys to shift down a bit. That's annoying. Then you've got your resources that were just assigned to you. So, you can look at your dust mite information, which I've shamelessly stolen off the Victorian Better Health channel. Or you can, you've got your direct links to visit, your key contacts, or you can just look through all the patient info. Obviously, that would be a really long list in real life. So then the patient can say, okay, I did this thing. I went to Amcal. I bought a spirometer. Job's done. And that'll tick that off. If they don't want to go there, they can also just click here. So that will take them to their short form survey. I might not do the whole thing because it'll take ages. So it'll say, okay, you missed a bunch of questions. We'll go back to it later. Then we can say, all right, what was our peak flow meter reading? Let's say 50. It was terrible. There you go. It's ticked off as done. And that is going to trigger another review. I'm pretty sure that'll flag our trigger. I'm fairly sure that we said less than. The patient won't see that, but the clinician who put the trigger in will get a warning sent to wherever they want it to go. And I know, if we put a low glucose, it's we did want to check if they were hypoglycemic. So that'll fire a couple of triggers off. Then and then they can go through and do their pathways as usual. So I can say, yeah, maybe you've been diagnosed with, that's it. And they can fill in their test, etc. That's all. Then if they want to do something in the future, it will just say, oh, you can't do that yet. It's not on your list of things to complete. So right now it's still got the 36 item survey because they accessed it but didn't complete it, and the test, so the list's sort of going down. And we'll put some encouraging messages in there, and sort of a your progress, like a percentage tracker or something in the future, and that'll be pretty handy, I think. But otherwise that's all of that. So sign out of the patient environment and go back in as a clinician and just have a look at what our patient's been doing. So we can go back over to the care plan builder, look at this guy. So now it says that they have logged into the system previously, so the password's gone. So they're just going to have to do a password reset if they forget their password. And then we can see, look, that some of their stuff's done, and we can see, oh, look, the peak flow is in there. Their blood glucose test was 1 millimole. That's about it. Yeah, really. You won't see the survey stuff yet. I think, that's more or less it. If you have any questions, shoot an email, as always. If you find anything wrong or any improvements, let me know. But otherwise, have a great day.